Uh, oops. I I was thinking something like aesthetic. Oh gosh, what was it that I wrote down? Um, Something with Wannalee or something like that. I don't know if that would be okay.
Yeah, I mean, you can do whatever there's absolutely like no pressure, and
Hmm.
whatever you choose, it'll be great. I mean, just kind of go with it. It could just be injections with Wannalee, or
Hmm.
Wannalee aesthetic injector, or the Virginia injector. It can be, whatever you want. So it's really no pressure, and you can change it, I think, up to 3 times if you don't like it.
Oh, okay, good to
Yeah.
know.
All right, so let's hop into the orbicularis oculi review. Okay, so quick recap. So kind of think back to training. The orbicularis oculi muscle, I consider that it is a medium muscle group. So that means that it can handle 5 fluid units into each injection point. So to recap on the 5 fluid units, you need, in order for this math to work out, you have to reconstitute Botox and Jeuveau at 2.5 and Dysport at 3 mLs. And then that way, that's where we get the fluid units at. So for Botox, Dysport, and Jeuveau, the standard is 3 injection points, 5 fluid units into each injection point. And then when you go and chart, you would chart, remember 5 equals 2, 2, 2, 2, 2, 2, 2. So for charting purposes, for Botox and Jeuveau, only you would go and chart 6 and 6. For Dysport, chart the fluid units 15 and 15. Whenever you are injecting, you always want to make sure you point the needle away from the eye. You don't want to hit the orbit or run the risk of hitting the orbit. And so you want to make sure that your needle is pointed away towards the eye. You can also do it straight up and down. Sometimes I'll hit it, especially on this side, I'll go straight up and down this way, then kind of hitting it at a diagonal. So especially on that right side, because I'm right-handed, sometimes that's a little wonky when, doing your hand position. I'm sure that the majority of y'all remember that. So, either just move the patient's head, or you can also kind of hit it from straight up. Again, 5 fluid units into each injection point. If the patient's on a budget, you can always decrease, the amount of units. Sometimes I'll delete the middle one and I'll just do the upper and lower one. Or if I don't think they need the total 3 injection points, sometimes I'll just do 1. So really just kind of feel your patients out and see what will work best for them. Any questions on orbicularis oculi? Remember that it is traditionally a depressor muscle group. It's responsible for closing the eye or depressing the eye. So whenever we paralyze it, it's going to do the opposite. So it's going to become an elevator muscle group when we put Botox or Dysport or Jeuveau in it. So that's why it's going to open up the eye. And then also that orbicularis oculi muscle goes all the way into the eyebrow as well. That's why whenever we do an eyebrow lift, it will lift up as well, because we're actually injecting the orbicularis oculi muscle.
And I guess if you did one, you would do the center one, right?
Exactly.
Okay.
Yeah. And there are some patients where like, I'm just going to do a little, I call it a dusting. I'm going to do a little dusting and I'll just hit, 1 and 1 on each side. So here's an example, and you want to stay about at least 1 finger breadth outside of that lateral rim of the eye, because there's really, the way that the muscles are, there's about a 1 centimeter area where the muscle is so incredibly thin that neurotoxin is not going to work. And if you get it too close to the eye, it can cause a little bit of dry eye and blurred vision as well. It doesn't last long, maybe a couple of days, but it's just something to be aware of. So if a patient says, hey, I just got some Dysport a couple of days ago and now I'm having a little bit of blurred vision in that eye, it's totally normal. It will go away after a couple of days or so. It's not uncommon to have dry eye as well, and it's just because you got too close to that lateral canthus. So just really make sure that you're staying that 1 centimeter out.
This is the one where, if I remember correctly, is you sort of cause a bleb, right?
Correct. Yeah, just like a
Okay.
TB test.
Okay.
Yep. Very good. Any other questions? Excellent. Okay, so now we're going to go into how you sign charts. So in order for me to do this, I am actually going to log into my aesthetic record, so you can see exactly how I do this. So in order to sign charts, you will do this at the end of every single month. Okay, we have a graphic for end of the month checklist, and this is on there. So this will you are forwarding your charts to your supervising physicians. So regardless if you're an RN and PPA, you always have to forward your charts to your supervisings, because our SPs, they co-sign 100% and review 100% of your charts. So this is how you do it. So you're going to go to aesthetic record from your browser, not from the app. Okay. So you're going to go ahead and you're going to log in from a browser. You can do it from your cell phone, but just make sure you go through the browser side. You can go through Safari. So once you go to aesthetic record and you log in, you're going to go all the way over here to where it says provider's room. Okay, so you're going to click on provider's room. And then you're going to make sure that you are clicked on cosmetic procedures and not health procedures. So these are all of the charts. Don't be me. Yep, don't be me. These are all the charts that I still have to sign. Hopefully Dr. Smith does not see this. I will do this later tonight. But these are all the charts that I have to go and I have to co-sign and send to him. So the way that you can check yourself as well is you want to make sure that you have green check marks on every single one of these lines. So on like this patient, Lindsay Pilkington, she is missing, it's probably her note. Let me go all the way up. Let's see what that second column is. Oh no, it's traceability. So if I want to click on traceability, like let me click on Nancy. Here, I'll click on Eleni. So if I do have a red X, I can go ahead and I can resolve that red X from this browser. So I would just go over here and I would click update traceability. And then I can click on the traceability here. Oh, that's probably why Stephanie hasn't put it in my thing yet. Well, let's see if my Disport's in there. There we go. Okay, so I can do my traceability on my Disport. So click on it. Scroll all the way down. And done. So now that check mark will go, it'll go from a red X to a green check mark. So that's how I know that everything is done. And once it's finished and I have now all of my green check marks, I can go and I can forward my chart to my supervising. So this one chart right here, this is Eleni Lacombe. So everything, I have all of my green check marks. I can go over here to click action. This way better. Click on the chart, click on action and sign. I've already kind of done my initial or my signature. And for the first time you do it, you do your signature and then you click on save signature and sign and send. And it will send that chart to Dr. Smith to co-sign. So super easy. Again, that has to be done from a browser. Okay. And you do want to make sure that you have all of your check marks. So like I can do, let me do this one too. Let me do Jenna Coda. So I have all of my green check marks. So I know that I can forward this chart. So click on it again. Going to go over here to action and click sign and sign and send. You do have to do them one at a time. Aesthetic record does not let you batch them all together because each chart is an individual medical record. So they won't allow us to do them kind of all together. Believe me, I've asked. So they do have to be done one at a time. Just make sure that all of your check marks are green though, and any ones that are red, you can go in and you can adjust. So that's it. Any questions on how you co-sign charts? Excellent. Okay, now we're going to go into cash drop. So cash drop is utilized for patients who pay via cash or check. They can also pay by Venmo as well. For Venmo, I do recommend that they don't Venmo you personally and that they Venmo the company. It just makes it so much easier. But essentially, you're going to kind of do the same thing if they do Venmo the company. So let's pretend that somebody gave you $100 in cash. Okay. So again, you're going to do all of this from the browser. I'm going to take that $100 that they just gave me, and I'm going to go to Wells Fargo, and I'm going to deposit it into the bank. The bank account number, all of that stuff is in the back of in Bamboo. Okay. So you'll go and you'll deposit it into the bank account. Once you get that receipt, you're going to take a picture of that receipt. Okay. And then you're going to do, this is where it's called bank drop. So you're going to go to aesthetic record again. And this time, instead of a provider's room, you're going to go to sales. And from sales, you're going to click on cash drawer. Once you click on cash drawer, it's going to show you your current balance. So my current balance right now of cash that I have that is outstanding for the month so far is $1,174.08. So let's pretend that someone gave me $100 and I'm going to go and I'm going to deposit that cash. I'm going to go over here and I'm going to go to bank drop. Okay, so I'm going to click on bank drop and I deposited $100. Okay. And then I'm going to take and then over here, I'm going to put Thompson bank drop. And then I'm going to take a picture of that $100 receipt that I got from Wells Fargo, or from, if it was a Venmo that they Venmo the company, I'll just screenshot their Venmo and I would upload that. Once all of that is uploaded, then I would go through here and I would click save. And you're going to see my number will go from 1170 to now 1,000. So it subtracted $100. At the end of the month, you want that to be zero. And that's only if you are accepting cash or Venmo. If you're accepting credit card the whole time, obviously this, you're not going to have to go through this exercise, but a lot of patients do want to pay you in cash, or they'll just want to Venmo you. And so just make sure they're Venmoing the company and just screenshot a picture of that Venmo. Super easy, or you can take a picture of it on their phone. And then if you do take cash, that does need to be deposited at the bank. Just take a picture of your receipt and you upload it here. Any questions at all on that? Excellent. Okay, moving on. Okay, let's talk about care credit. So care credit is integrated within aesthetic record. It does take 2 steps. It is a 2-step program. So this is the graphic for care credit. There is also a graphic on the Facebook page and on Bamboo. It is essentially this exact same information. So whenever you accept care credit, you are going to go through the entire process in aesthetic record. At the very, very end of aesthetic record, it actually has something that says care credit. Whenever you click on that care credit, that doesn't mean that it actually pulled it from that care credit account. That just means it lets Brittany know, who is our finance person, that we should be receiving money from care credit. Okay. And that's how the company is going to be reimbursed. The second part of that step is this graphic. Okay. And that is where you have to go in and you need to go to carecredit.com, go this / and then pay now, and you go through this entire process. It only takes about 5 minutes to do or so. A lot of patients are using Cherry more than care credit, but this is just another payment option that we want you to be familiar with. So I want you to know that care credit is a 2-step process, and that the process it's in a graphic, and it's very easy to go through. You just go through aesthetic record just as normally, close the patient out, then you're going to go into carecredit.com, fill all this information out, submit, and then you're done. So it probably adds 5 minutes to the checkout process, but just know that that is available to your patients if they do want to utilize care credit. Any questions on that?
You can do that later on, right? Or do you have to do it then?
No, you can do it later on. Yeah. As long as, I usually do it at the appointment or the next, I'll get home. I'll do that. Sometimes I'll do it the next day, depending on the patient. Sometimes the patient will have their care credit card right then and there with them, and it makes it super easy. I have one particular patient, she never has it on her, and I always have to go through this back end and do it this way, which is kind of frustrating. But I just want you to know that this is an option that you can have for your patients.
And I think that gives them like 4 months to pay certain amounts or something like that.
Correct. Yep, exactly. All right, now let's talk about Cherry. So Cherry is fully integrated within aesthetic record. So it makes it super simple. So you literally just click Cherry and then it walks you through every single thing. It will send the patient the prompts. It does give them automatic credit as soon as they sign up. I have yet to see anyone not qualify for it. And it's very similar to care credit. They can choose their terms anywhere between 4 to 6 months to pay off. Essentially, it's like another credit card. Again, it's just another payment option, but I do prefer Cherry over care credit because Cherry is fully integrated within aesthetic record. And so it's just one less step for me. As far as the company goes, it pays the exact same amount. The fees are the exact same for us. Cherry is just easier. But if the patient already has an account with Care Credit, they can do that as well. But Cherry is fully integrated within Aesthetic Record. So there is a button for Cherry. You click that and then it walks you through everything. So, very easy. Okay, so this is the homework for this evening. So for this next week, you are going to do 2 salon reach outs. Okay, so a couple weeks ago, I had you reach out to 1. This week, it's going to be 2 salon reach outs. They can be dentist office, they can be primary care, nail salons, hair salons, massage therapists, estheticians. It can really be anything. Anything can be considered a salon. So I want you to reach out to 2 this week and you're going to follow up. Remember, the key to success is in the follow-up. And that is to get them to become a salon account for us. It's just another way to network and to tap into those salon accounts network. So that's going to be the first part of your homework. The second part of your homework is to post a before and after of crow's feet using Jeuveau with a flat rate of $145 if they use Jeuveau. I already have this graphic for you, so I will post it on the Facebook page tomorrow. That way you can just grab it and post it. So it makes it super easy. The only way the Jeuveau coupon works is if they have not received Jeuveau yet in the past 90 days, because it does give them $40 off. So that is how the math makes sense. Okay, so they do have to use that $40 off from Jeuveau, especially if they're a new patient. It makes it super easy to sign up. Again, fully integrated with AR. And then the last part of the homework assignment is going to be 1 education post about resting stasis. Again, I already kind of have this post for you, so I will put it out there. If you don't like my post and you want to come up with a different one, knock yourself out. But I will post both of those graphics tomorrow morning for you, so you have them. And then continue, obviously, your social media following. You want to continue to add tools to your tool belt and listen to other people. These are the 2 people that I really, really like a lot. Codafana is a guy who does a lot of cadaver dissection. So he has a lot of great anatomy tips and tricks. He really goes into why you inject in certain areas and how you inject in certain areas and how it impacts what's underneath the skin and in the underlying anatomy. And then finally, Dr. Tim Pierce, he's great. He does a lot of education of emergency situations and how he injects. Again, just trying to continue to add tools to your tool belt and to follow people who are held in high regard in the aesthetic community. So that is it for this week. So nice and short and sweet. What questions y'all have for me?
I have a question. With the salon reach outs, do you typically give them a brochure or anything, or you?
Sometimes I do. Sometimes I'll give them a brochure. Usually the first time, whenever I go into salon, I will just introduce myself to the front office girl and say, "Hi, my name is Ann Thompson. I am a nurse practitioner. I do aesthetic injections, and my company offers the ability for us to offer aesthetic injections to your clientele. We do compensate you for the time that we utilize for your space. And I would love to set up a time that I can speak to your owner." And then usually I'll start there. And then I will follow back up with that receptionist and say, or, do you have a card for the owner so I can reach out to them? And then I'll send an email, or I will, give them a call. But if I do have a brochure, I will give that to them. That's the easiest. But sometimes that tends to get lost, just in translation between the front office person and then the owner. So I do like to try to kind of set up a meeting. So, and that's what I want you to do, is I want you to get to set up that meeting with this first reach out.
And I think they get $25, right?
It's $20 for neurotoxin and $40 for filler. And that's per patient. Rachel, Aaron, do you have any questions?
I don't think so. I think you covered everything.
Perfect. Are y'all liking these calls?
Oh yeah.
Mm-hmm. Go ahead. I'm sorry.
Yeah, it just kind of breaks things down just like a little bit smaller, and you're just kind of like, okay, think back to training. Like, okay, I got that. And
Mhm.
just starts to integrate little things. I know that y'all went over a lot in MFL day, and I know that was kind of like information overload. So when we kind of break these down, it just kind of like, okay, I remember how to do this. And now I'm like in the thick of it. Okay, now I got to do cash drop. I just watched this. And so we try to break things down a little bit in smaller bite-sized pieces. So. All right. Well, I
Yeah,
will
I like
post
that because it is overwhelming initially.
100%. All right. Well, I will let y'all enjoy the rest of your Sunday evening, and I look forward to hearing about your homework assignment for next week, and we'll see y'all next Sunday.
Right,
Thank
thank you.
you.
Have a good one.
You're welcome. Bye,
Thanks.
ladies.